So today we're going to be discussing the topic of medical billing fraud and how to prevent it. And I have Tami Rockholt and Mike Fossey with me today, two experts from the medical billing fraud area. Maybe you guys can briefly introduce yourselves.
I am a nurse and I am a consultant to Inform, and I really enjoy trying to prevent medical billing fraud.
Mm-hmm.
And my name is Mike Fossey. I'm an engineer. My role with Inform is to develop algorithms to automatically detect medical billing fraud and also to analyze the data that results, and so we can improve those results.
Mm-hmm. So medical billing fraud is nothing new. It's actually a very big problem associated with a lot of money, according to the National Healthcare Anti-Fraud Association. It's tens of billions of losses associated with medical billing fraud. There's bill review companies in place. They're reviewing these medical bills, repricing billed lines, but yet we still catch some fraud, some errors. Why?
I think the main reason is medical bill review companies are looking at each line item very specifically for looking at the pricing within a local geographic region. What RiskShield does is we look at the whole picture and keep a provider history. So it is very different. It's very additive.
Okay. So digging a little deeper, how does, maybe Mike, you can address this, how does RiskShield medical billing differ from what the bill review companies are doing?
It really differs in three ways. One is, as Tami mentioned, we keep a provider history. So if we see suspicious activity within a given provider, we save that activity for later. Mm-hmm. And then when we evaluate later bills, we're using that previous knowledge to analyze the newer bills. We do the same thing with a claim. So as a claim progresses, if there's suspicious activity, it sort of builds up a baseline of suspicion so that things are looked at with a little bit finer tuned view as we go along further. The third thing is we're looking at specific patterns of fraud that are known in the industry over many lines, not just on one billed line. So when we see a pattern emerge that's a known fraud pattern, we immediately highlight that and alert the insurance company.
Okay. Why would you say it makes sense to use RiskShield medical billing?
Well, because after the bill review company has reviewed the bills, they create quite a bit of savings in the repricing and by disallowing some items. Mm-hmm. But then we find an additional amount, a substantial amount of fraud, and some part of that can be immediately denied through the use of standard denial letters, okay, because some of the bills don't conform to commonly understood medical billing rules.
Okay. Mm-hmm. Do you have a specific example, maybe that you can use?
Yes, in a recent study that included $16 million worth of charges over roughly a 6-month period, the bill review company had taken that $16 million and allowed $6 million by a combination of repricing and disallowing some duplicate charges and a few other things like that. The RiskShield program then analyzed that $6 million worth of allowed charges and found another $1.1 million of additional suspicious charges.
Okay.
And then of that 1.1 million, roughly 20% could be handled directly by claims by using a standard denial letter and not require additional work by the special investigators or their attorney firms.
Okay. Some impressive numbers. So, Tami, if somebody was interested in finding out more about RiskShield, about detecting medical billing fraud, what's the best way to reach out?
I think the best way is to go to riskshield.com and then there's a contact button, hit that, and we will answer, if not the same day, within 24 hours.
Okay, so they're coming to you with their medical billing fraud, medical billing error, any type of medical billing type of situation to you guys, and we'll be able to help them out.
Yes.
Yes.
Okay, perfect. Thank you for your time.
Thank you, David.